Hi, I'm Dr. Olga Pinkston, a board-certified rheumatologist and the host of the Mind Your Fibro podcast. This podcast is dedicated to fibromyalgia. I discuss up-to-date information about fibro, its treatment, the biology and psychology of the fibromyalgia. I cover the pain science education, the complementary and alternative methods available to you now to improve your symptoms. There are a lot of things that influence development of fibromyalgia, trigger fibro flares, and produce other symptoms like IBS or irritable bowel syndrome, depression, and anxiety, and none of them are your fault. In the Mind Your Fibro podcast, you will learn how and why fibro develops, how chronic pain changes your brain, and most importantly, that you're not alone in the struggle, that fibro is real, and how to not let fibro control your life. This podcast provides information only and does not provide any medical or psychological services or advice. Well, welcome back to Mind Your Fibro podcast, episode 32. Today is a part 2 of my interview with Theresa Feola. We continue talking about pelvic dysfunction in both men and women and available therapies. Theresa is a physical therapist who specializes in pelvic health. She is the owner of the Pelvic Room in Exton, Pennsylvania. She is also the co-founder of the Perinatal Partners Network, an organization focused on providing integrative resources and care during the perinatal period. Today, we talk about sexual health and intimacy and the role of pelvic PT in addressing painful sex. We'll also talk about trauma with childbearing and pelvic dysfunction associated with history of trauma and sexual abuse. You can find Theresa's information in the show notes. And if you missed the part 1 of this interview, please go back and listen to the episode 31 of this podcast. Thank you so much for listening. Another question will be about sexual health and intimacy. Not a common subject I discuss in rheumatology, I must admit, but it does come up more so in the patients who have fibromyalgia. It may be because of the pain, because of the side effects of medications. Many people take antidepressants that can cause sexual dysfunction or side effects. So often patients tell me that they are in pain all over and everything hurts. Their joints, the muscle, the skin, touching, even hugs are painful. So obviously sex involves a lot more than just touching and hugs. And is there a role of physical therapists in helping fibromyalgia patients with painful sex?
Definitely. Although I must say in those examples too, that would be the end goal, right? First, we need to get you where hugs are okay, right? Like, let's start with the external muscles and really that alarm system. When you can't tolerate pressure of a hug, that's that alarm system is upregulated. You are feeling, sensing, hearing things 10, 20, a million fold of what would be a very typical situation. So we're bringing that down via what you and I have talked about, like nutrition, counseling, mindfulness, sleep. That's all what calms, because we're trying to show the body it's safe. It's safe. So first I have to feel safe in my external body and get to know my body and have good health habits. Then would come the pelvic and the sex, right? And what also goes into that is, how is that relationship? There's no way we are going to have pain-free, enjoyable sex if there's a little discord or something in that relationship that needs to be addressed first, right? So the benefits of a healthy sexual relationship are enormous. Decreased blood pressure, we get oxytocin released, everything that we're talking about that would help a situation like fibro or any of the dysfunctions we've talked about. That's one of the many treatment modalities that we have to offer, but we have to slowly, gradually, and look at what is breaking down in that. why is the pain? And that can be a tissue problem, that can be a lubrication problem, a muscle problem, a mindset, a protective problem. Our nervous system certainly turns off libido when we are running from a tiger. We're in sympathetic, right? So the first step is I do have to figure out and how to find that relaxed state. How do I receive? If I can't receive help, compliments, touch, if I can't receive in my everyday life, I'm not going to be able to receive in that deeper, more intimate environment. So it's kind of a progression of health and safety, if you want to think of it that way. But we certainly, graded exposure. Can I start to touch and work? And it's amazing what is held in the pelvis. That pelvic bowl holds emotion. Our body does everywhere, but the bowl really does. The sacrum comes from the word sacred, right? We have a lot of nerve endings at that sacrum. When I touch the pelvic floor, it is amazing how sometimes the tears come out of nowhere and clients will be very surprised. But that's the healing. That is it's almost like a pressure being, let out of a can, a soda can, right? That emotion starts to come out, and that's being held in those muscles. So that starts that healing process too.
Now, the question is also, there's a polyvagal theory about how our nervous system gets activated or dysregulated. And one of the issues is this sense of neuroception of how our body perceives the inside, the outside, as well as co-regulation with others. We need other people in our lives to co-regulate with us. So if we have a healthy sex life, it's actually co-regulating our nervous system in a good way. There's a release of hormones. So tell me about this polyvagal theory, the nervous system activation, how the vagus nerve has many things to do with sex life and pelvic health. It's so fascinating to know that there's an organ or complex part of our body that is sending a lot of signals to the brain.
Yes, definitely. So a lot of people go to counseling and we're working from the brain down, right? To try to help, to try to heal. But we also can work from the body up. And each client is different. Where can I start that process? Some people feel way more comfortable starting with the head and trying to then get the body in line. Other people feel way more comfortable with movement and body before they really want to go into the deep cognitive, emotional. But we can start to bridge that gap of, well, emotions are in your body. And so the vagus nerve is doing an amazing job of reporting the state of the union of the body. So 80% of the fibers are going from body up to brain. And so we can influence, if I am doing short, shallow breathing, we are getting signals. There is an emergency. I'm running from a tiger. So then there's going to be a cascade of what happens. My muscles tighten because the brain is believing and the nervous system is believing there is an emergency. I can also dampen that and notice my breath, notice I'm short and shallow, and change that to, I'm not anxious. Let's do some slow, deep belly breathing, which is opening the floor, which is a very vulnerable thing. So then the vagus nerve is reporting up, she's safe. All is fine. Just relax. So we can utilize that breath and knowing our breath and being able to change our breath and slow it. And there's multiple exercises for breath. And that is a tool that you have in your pocket at every moment, no matter where you are. I'm feeling anxious, or I just had a trigger that, a sense, a person, a place, a thing that is triggering me. I can bring it down with the breath and that floor. And so even within like the GYN exam or the sex example, let me use my breath to try to calm the pelvic floor down. It's an amazing tool. I think a lot of times we're thinking the body as just this vehicle here that, you know, I'm moving around. It is a living, sensing thing that is working with you. And the closer we get to like loving and working with the body and that sense of connection and, you know, good enough, I am pleased and I am satisfied with me as a person, with my body. And I mean, that's more true health, right? That encompasses everything we're talking about. But anybody who has chronic pain, I think, is really down on themselves, right? I am broken, I am this, I am that. And so the spiral continues. But we can use, no matter what the person is walking in my office with, breath is one of the very first things where we start. The body wants to heal. It wants to go back to homeostasis. So it will start to feed into some of these nice signals of calming and breathing. That decreases our heart rate. It decreases our blood pressure. There's even studies with sex, masturbation, ejaculation for men, decreasing prostate cancer likelihood. There's, let's see, I know there's other migraines, even cluster migraines, that sex decreases incidence of migraines. Like it's so interconnected with health, like you're saying, but there's a slow, gradual way. We should never accept pain with sex, because what you're teaching the body is this is bad, this is wrong, this is scary. So every time we go into pain, we're reinforcing that. So that is not the root. There's way other roots. There's dilator therapy that we slowly, gradually work with. And what it is it is not about me putting something in and stretching the muscles. It's about you learning to regulate your thoughts, your emotions, your breath, that yes, something is touching, but let me regulate the system and eliminate the pain, is how that works. I think very often people are thinking, when they know that we work with dilators or wands, that it's not about stretching and moving. I'm touching the tissue and we're working with the brain and the nervous system and the body for you to open and relax and take the pressure and the pain off of whatever is touching you.
Interesting. Yeah. Now, the next few questions may be triggering or negatively activating nervous system for some patients. So this is a warning that this may be a difficult conversation for some patients or some people. We will be talking about history of trauma and sexual abuse. So you're welcome to pause or skip the next few minutes if this subject is too sensitive to hear. Now, there is an association between the history of intimate partner violence, domestic or childhood abuse, or trauma, and the development of functional syndromes, including fibromyalgia and chronic fatigue syndrome. Do you see such history in the patients with chronic pain, pelvic pain?
Definitely. The risk of tightness because of that protection of the nervous system and that triggering is huge. I don't know a percentage, the vast majority of my clients. We know the prevalence of sexual abuse and history, any abuse, but then certainly sexual. We see that you're at a higher rate of C-section if you have a past history because of that pelvic floor and that triggering, that pelvic floor protection and tightening. We see, even GYN exams as a trigger. The brain is just trying. It makes sense in any other scenario if you put it with, if I fell off a horse and then my friend says, let's go horseback riding, that feeling that we get tense. I don't know about this. I'm nervous. I'm not going to enjoy this, versus if I've been horseback riding, it's been the most beautiful, amazing, experience I have. It's those memories, and the nervous system is recalling on that in order to protect you and set you up. Was this good? Was this bad? And it's unable to distinguish between past and present. It has a very hard time doing that. And so we have to reassure it, this is okay. We're in the present. And there's many techniques, body, mind, soul, to help bridge this gap, and ease that trauma. So working with multiple practitioners, but and it's part of the healing. There's once again where so often people are seeing only psycho-counseling and working from the brain therapy, but we need to work from the body therapy. And there's multiple avenues to do that. I mean, complementary medicine, Reiki, to let the energy out of that pelvic chakra is the piece, right? Very not touchy, not taking clothes off. So where can the person start to heal and reassure safety?
Yeah, if somebody has a history of sexual abuse or assault, the effects may span a lifetime, and they may not even put together that the pelvic dysfunction they're having now in their 50s may be related to experience of the childhood. It also affects obviously sex life and intimacy. How you mentioned physical therapy and the relaxation techniques and counseling. So this is a comprehensive multi-modality approach to that, but understanding the relationship of trauma from the past can echo throughout your life and through your entire health in terms of presenting as pelvic pain or fibromyalgia or chronic headaches or tension headaches. Do you work closely with OBGYNs, or how do they refer patients to you after sexual assault, or this is something that patients just wander into your office on their own?
Unfortunately, I do think it's happenstance how they get there. Maybe a few counselors who are aware of pelvic PT or me will send clients over. Definitely if young girls are having trouble on that GYN exam, like we said, I think there's not that they were, clearly sexually abused or anything in the past, but that idea that trauma somehow is there and associated. We need to help them overcome that. But yeah, I still think it's very hard for us to see that this is a nice adjunct to healing and path, and that we do need to incorporate even yin yoga, right? Different postures are triggering. Anything where we're exposed, the buttock is up in the air in yoga, can be very triggering if you have any kind of history of abuse. So we could slowly, gradually work from easy, safe postures in. And we do that in pelvic PT, positioning. Men, I work with men who, and several who are just starting to have little bits of flashback and memory that they really didn't know that they were abused. And it's starting to come out. They're seeing counseling. And so now we're working with some of their pelvic complaints and how that's tying together.
The prevalence of sexual abuse is underestimated, but I heard the statistics is 1 in 4 women have been sexually assaulted and 1 in 6 men. So, and this is kind of unreported. There's many cases that are unreported or not talked about. So there's prevalence is probably much higher than that. So when this podcast is listened to not just by the patients, but also providers, physical therapists, physicians, nurse practitioners. So I just want to bring to attention that when people have chronic pain, it's always something else may have triggered in the past this pattern. It's not patient blaming or patient shaming. The question should be, what happened to you?
Yes.
And that's missing often in our conversations.
Mm-hmm. Yes. And it doesn't have to be as we say, like capital T, like the big traumas, right? Sometimes it is just something a little more stressful in childhood in particular. Or a little bit of a neglect, or just where you ranked in the number of siblings and how you were treated, that sets this pattern up for your nervous system. And that's why it's so individual and just so important that multiple practitioners, we all communicate a little bit differently, even though we're saying kind of the same thing. And what resonates and maybe helps me to pull some of this out, maybe it's one different practitioner, maybe it's hearing it multiple times from my counselor, my PT, my doctor, where we're all at least talking with that language that the nervous system patterning set up, and how that affects our health. That would help tremendously, because I think we're really getting more of individual in our silos, and people are listing their medical history, and I have this and I have that, which makes me feel even sicker and more broken. But if we all start, talking together that it's this, something happened, something set my nervous system up to be overly protective, or I'm constantly feeling a deep inner stress. Yeah.
Now, this podcast was my COVID baby project. I've put a lot of effort into this because I didn't want to focus on COVID, and this came out of that. Now, tell me about your project. You also have a project called Perinatal Partners Network. It's an organization focused on providing integrative resources and care during the perinatal period. Tell me about that. What is exactly is your project about?
Yeah. We touched on it during our entire conversation. It is the frustration that we feel with people suffering unnecessarily, and trying to have more of a call to action for all of us to come up with a better way, right? A better way of treating. I know we can do better and we can serve better. This just happens to be in that niche because it's such a transitional period for women, where I felt that we were normalizing so much. And maybe years ago, we didn't know, right? But now we have the testing, the research, and everything to know what is actually going on in pregnancy and delivering and for women. And we're still not changing, and we're still not getting the care. And so that being dismissed and misunderstood has gone on since the beginning of time in women's health. Women were not even included in any medical research until 1994, when the National Institute of Health passed that law. So 29 years only is what we have. So this is also why a lot of the women's dominant diagnoses take a long time to be diagnosed, actually, right? Endometriosis, 7 years. So autoimmune, more of women issues, and it really, they're a little more vague, and we just don't get to it right away. And some of that, unfortunately, is a little bit of a bias in the medical system, dismissal of women. And when you read back in history, there's a lot there and a lot to it. So it was my frustration of seeing women walking in and saying, I've complained about this tailbone pain ever since I had my child. Well, how old is your child? 12. Like, you've been putting up with tailbone pain for 12 years and nobody has tried to address this for you. Painful sex, have a glass of wine, no, that's not medical advice. No, so that frustration led to a chiropractor and myself. We started to meet and discuss, treatment of women in the perinatal time period. We each realized that we knew 20 some other practitioners in our geographical area that treat this in all different ways: doulas, midwives, massage therapists, personal trainers, like acupuncturists, so many different practitioners. And we said, oh, let's get together for coffee and talk. So we got together. And then thanks to Joe Tata and his innovator program, he's the one that really said, your little coffee chat is what you should run with. Like this, you need to make change. And this is how we're going to make change. So we started the Perinatal Partner Network, and now there's a website, and now we are up to 75 different practitioners in 16 different specialties. So our mindset is always so limited, I think, of what healing and medicine looks like. My goal is, let's get you resolution one way or another. It could be very different because of your ethnic background, because of your past medical history, your beliefs. Maybe you believe pure, strict medical interventions. Somebody else is like, no way, I don't want any surgery. I don't want any medicine. Like, well, what else do I have? What can I do? But anything that we're complaining of that just, sometimes it's not a big sickness. It's just unwell. I'm just not quite right? I'm just not quite as happy as I used to be or whatever in the postpartum. Like, there's just so many ways that we can address this. And that's what we're trying to do. So we meet 4 times a year. We start to know, I have learned so much. I've been a practitioner for 35 years in this area. I didn't know what was in my backyard. Women, how they could be helped and benefited from so many different practitioners, craniosacral body workers, the evidence on doulas in delivery and how that prevents and helps so much of it. Like, so much information comes out. So as the practitioners, we're all learning. The idea is hopefully women get connected to the network via the medical community or a woman or Facebook or whatever. If you call me and I'm not quite your wheelhouse, but I'm hearing your complaints, I know somebody in this network, and somebody in this network knows somebody outside the network. And we are not going to stop until things are resolved. I would love to see this collaboration and this model go on for everything that you and I have talked about, right? We just that, hey, it's bigger than just one practice. Like, let's all work together, nutrition and sleep and stress management. And what does that look like for each person? So that's what I'm working on as my community service project.
This is awesome. Now tell me about your clinic. You have private practice, the pelvic room. Where is it located and what do you do there?
So I opened in 2020. Same thing. So many of us did a COVID kind of switch. I was unhappy and I was becoming unhealthy in my job because I was working in a traditional medical outpatient physical therapy clinic doing pelvic work. But under the model, I had to see a lot of clients in a day and back to back. And what I do, undressing, intimacy, talking about all these things, I just couldn't do that quickly. And I was starting to just really burn out, I think is probably what was happening. I was trying so hard myself to be healthy, to get my sleep, to do yoga so that I could do my job and do it the very best I could. And thank goodness COVID stopped for a minute and I got to think. And I decided that I love what I do. I just need to do it differently. So I ended up going out on my own, which I never thought in a million years I would do. I am cash-based so that I can do it the way that I want to do it with hour-long appointments, and that the client is really my focus. It's not the insurance. It's not putting things into a computer. I'm not seeing that many clients in a week. So I have the time and intention and energy to give to each of my clients. And for me personally, that was the goal. And I feel really good about the care that I'm giving. So I opened the pelvic room in Exton, Pennsylvania, and that's what I'm doing. I work out of a collaborative wellness. So that is really helping. Like I'm talking like we're each working in our silo. And I don't think that is how everything you and I talked about is multifactorial, right? Not just one thing is causing that person's complaint. So I think we need to get out of our individual silos and interact and work with each other. And so I work in collaborative wellness. So now I'm getting to see a lot of different practitioners and how they work and how they view what I'm seeing as a pelvic PT, and maybe they view it from an acupuncturist standpoint. And so that's helping. And I definitely see people getting better, and that there's a lot of hope for everything that you and I talked about today. Yeah.
It's so great. Now I will list your perinatal network information as well as your practice information in the show notes. Thank you so much for such informative conversation. It was a long talk, and I had many questions for you. I probably will have more questions for you as we go along. I hope you will come again. But thank
Definitely.
you for your time and your expertise.
Thank you. I love your work. I love what you're doing. It aligns with my mission of us all working together. I think we'll get people feeling better.
Yes,
thank you.
Thank you so much. Thank you.
Thank you.
Thank you for listening to this podcast. If you enjoyed today's episode, the best thing you can do is to share with someone and leave a review and rating. This helps me support more people just like you move toward better life with fibromyalgia. All you have to do is to go to the platform you're listening on, click the share button or the icon, and just send it to a friend. I so appreciate you taking your time to do so. Make sure you sign up or subscribe to this podcast so you can get the most up-to-date information in the new episodes. Thanks for joining me today, and I will see you next week. And don't forget to mind your fibro. Disclaimer, this podcast provides information only and does not provide any medical or psychological services or advice. None of the content on this podcast prevents, cures, or treats any medical or mental condition.